Thanks a lot for the opportunity to present our work, which is about domain generalization in the medical field. My name is Markus Philipp, and the work I present is the result of a collaboration of three institutions, namely in Hospital of Bern, KIT, and Zeiss Meditec. Towards applying deep learning vision algorithms in clinical routines, domain generalization is critical, since on the one hand, they must be robust despite typical domain shifts, such as induced by different types of surgeries. On the other hand, typical for the medical field, training and test data sets are often small to medium size, which make it difficult to train well-generalizable models. Specifically, we focus on the problem of localizing tips of surgical instruments in neurosurgical video data. Here, you see a typical scene in a brain tumor intervention with surgical instruments. As corresponding labels, we consider the yellow saliency, which marks the location of the surgical instrument tips. Using deep learning methods, one can train a CNN directly on the image information to predict the saliency. Other than that, a CNN can be trained on optical flow input, that means motion information. In this situation, at the beginning of a neurosurgical intervention, the image-based CNN, which exploits visual appearance information, works well, but the optical flow-based CNN has a false positive prediction here. This situation is very atypical in terms of visual appearance, with the surgeon's gloves covering large areas of the image. Consequently, we assume that the image-based network thus fails. However, the optical flow-based CNN still seems to cope well. These predictions exemplify that the image-based CNN and the optical flow-based CNN generalize differently well in different situations. In our work, we focus on the question how we can optimally combine the generalization behavior of image and optical flow with respect to domain generalization for our problem. Our idea is to use a dynamic network that during prediction decides whether to rely more on appearance or optical flow depending on uncertainty. For that, we train two independent ensembles, one ensemble on image input and another one on optical flow input only. Then we compute the pixel-wise means for each ensemble. As said, our dynamic CNN builds on uncertainty. Specifically, we compute uncertainty as pixel-wise standard deviation along the ensemble individuals. Then we convert the uncertainty maps into uncertainty masks by comparing the uncertainties of the ensembles. The uncertainty masks denote where a network is more certain in the image-based prediction and where it is more certain about the optical flow-based prediction. Finally, we combine the mean predictions of both ensembles by linearly weighting using the uncertainty masks. This weighting step allows our network to optimally combine image and optical flow for each sample individually. A further advantage of our method is explainability. If we look closer at the mean outputs for the ensembles, the optical flow ensemble has a false positive prediction here, but our network ignores it, which can be explained directly from the uncertainty masks, since the values at the corresponding location are close to zero. In our experiments, we include 4 different baseline methods. Single modality CNNs are trained either on image or optical flow. As fusion baselines, we take a learned fusion model LFuse from the state-of-the-art that directly builds deep spatiotemporal features. Furthermore, we use a simple baseline pfuse which averages the outputs of the 2 single modality networks. To assess domain generalization, we assume we have access only to one data domain, namely neurosurgical tumor cases. We train our method on all baselines on this data. Then we test on various other neurosurgical domains with small to medium domain shifts and large domain shifts represented by this phantom data. Furthermore, we analyze qualitatively how a method performs in completely different surgical disciplines, namely eye and abdominal surgeries, which impose a strong domain shift. Coming to the results, we see that among the baseline methods, there is no clear winner, which performs best on all test domains. Our method UFuse performs always in the top group, however, irrespective of the level of domain shift, and thus outperforms the baselines. Now looking qualitatively at in-domain test data and test data with large domain shifts, the results are in line with the numerical findings. Now looking at dataset that impose an even stronger domain shift than the phantom data, our method still achieves reasonable predictions. Thank you for your attention.